Hello, I am Dr. Parang Mehta. Welcome to my channel. Today we are talking about the pneumococcal vaccine. There are many vaccines that are given to children to protect them against serious and life-threatening diseases. This is one of the most important. Pneumococcus is a bacteria. Scientific name is Streptococcus pneumoniae. It causes serious diseases like pneumonia, meningitis, which is an infection around the brain. It can cause death. Survivors often have a lot of residues. Bacteremia, which is an infection in the bloodstream. Otitis media, which is the infection of the ear, which can lead to deafness. Infections in the bones. Osteomyelitis, infection in the joints. Septic arthritis. It causes a lot of diseases. Among the pneumonia in children, 30% is caused by pneumococcus. Around the world, pneumococcal infections are responsible for 500,000 deaths of children every year. So it's a deadly disease and a vaccine against it is very valuable. We have two vaccines for it. The older vaccines called the pneumococcal polysaccharide vaccine can only be given to children older than 2 years. Now the diseases caused by pneumococcus are most serious, most deadly at younger ages. Children under the age of 1 year are most susceptible and most likely to die of this disease. So the polysaccharide vaccine is not much used. What we use today is the pneumococcal conjugate vaccine, which can be given to young babies. We have two of these available. This is the first one. It's known as the 10-valent pneumococcal conjugate vaccine. It protects children against 10 serotypes of pneumococcus. Here is a closer look. You can see it is manufactured in Belgium and is now made available in our country. And here is the other vaccine. This is the 13-valent pneumococcal conjugate vaccine. It protects children against 13 serotypes of pneumococcus. This is the vaccine that has been selected by the government of India for giving to children in our country in government hospitals. It is not yet available in all over the country. It is available in several states and gradually the program will be expanded to cover the entire country. Here's a closer look at the vaccine. You can see it is made in the United Kingdom and it is now available in our country. What are serotypes? Serotypes are various strains of the pneumococcus and each one of them needs to be protected against individually. There are more than 90 serotypes known and you may think that with so many serotypes, what good will it do to protect against 10 or 13? But most human disease is caused by 10 to 12 serotypes of pneumococcus. So if children are protected against 10 or 13 serotypes, they are protected against 70 to 75% of disease caused by pneumococci. So it's a good vaccine to use. How many times does this vaccine have to be given? It is given 3 times in the first year at 1.5, 2.5 and 3.5 months. After this, 1 booster dose is given at the age of 15 to 18 months. These 4 doses complete the course. Suppose the vaccine could not be given on time. If the child is now between 6 and 12 months of age, you have to give him 2 doses of this vaccine separated by a month. After that, 1 booster dose at the age of 15 to 18 months. If the child is already over 1 year of age, then he should be given 2 doses of this vaccine separated by 2 months. Beyond the age of 5 years, this vaccine is not recommended. Now it sounds like it is better to give the vaccine late because less doses have to be given. But remember, pneumococcal disease is deadly in the first year of life. It is most dangerous in young babies. So if you give the vaccine late, the baby remains unprotected against this serious disease when he needs it most. So give this vaccine as per schedule on time as far as possible. This vaccine has a few side effects. In the limb where it is given, you will notice redness, some swelling. The child will find it painful. Children are irritable, have little less appetite on the day the vaccine is given. There may be some fever also. These are mild side effects and last for a day or two. Some children, 1 in 1,000, will have a serious allergic reaction. And that is why vaccines should always be given in a hospital where there exist the facilities for managing serious reactions. Should you give this vaccine to your child? The government of India estimates that 500 children die of pneumonia every day in our country. So pneumococcus is a serious disease, and this vaccine protects your children from a life-threatening illness. Certainly you should give this vaccine. Ask at your nearest government hospital if they are giving it. If the program has not yet entered your state, pneumococcal vaccine will be available at a private clinic near you. Thanks for watching.